face do you think about when you hear the words cheerful, happy and friendly? Probably not a doctor's surgery. And what normally happens when you get sick? You go to the doctor, get a prescription in order to help your sickness. Have you ever wondered if there is an alternative treatment to normal traditional medicines? Well, today I'm here at Ashfield General Practice in Sydney, about to introduce to you a doctor with a difference. I'm here at Dr. Nguyen's surgery with two of the phlebotomists, Alice and Chantel. We're going to have a chat with them and find out a little bit more about what it's like to work for Dr. Nguyen. How are you today, girls? So what is it like then working for Dr. Nguyen compared to other doctors that you may have come across, Chantel?
I've never worked for any other doctors, only Dr. Nguyen, and it's just like working with a friend.
Hello, Dr. Nguyen. How are you today?
Good morning. Very well.
That's good. I noticed that you wore the pink shirt just for us.
If nothing else, it kind of bring a smile to the patient's face, and that's already therapeutic as it is.
So the girls at the front are very, very lively and friendly. And maybe that's because of your pink shirt that you're wearing every day.
Well, it comes
it rubs off on them too. It comes from the top.
It comes from the top.
Yeah.
We believe that they have as much a therapeutic role to play as the doctor.
What is the vitamin infusion or Myers cocktail?
A GP friend of mine was talking to me about a good, high-quality supplement that he's stumbled upon and wanted me to try it. Now, like most usual GP at the time, I said, "Oh, no. Vitamin is not necessary when you got a normal, good diet already." But he countered each and every argument with study and graph and things that show that, oh well, maybe not. It does work. It does. We not our lifestyle these days are not so great. That was me, age 32.
Yeah. At
the time, this is just before I take the vitamin. Then for the first time, I thought I felt like 50 at the time, and so within 3 days of taking this, I felt much better. And remember, I was a skeptic, and that makes me think, oh, maybe he's right. And that started my journey toward learning more about it and applying the very benefit that I found with vitamin personally for myself and my family and for my patient. I was able to help patients with their problem, whatever they need, namely because of lack of that kind of lack of vitamins or not an optimal level. Modern medicine pay lip service a lot to so-called preventative, but we don't really do that much preventive. Everything you do, even like breast mammography, all that is just early detection. It's not prevention.
Right.
You see, so again, it's not true prevention.
Have to go through the treatment.
Well, it's not prevention. It's only early detection. You still, focus on to treating a bit early. That's all. But it's not really true prevention.
In your opinion, though, do you think doctors somewhat over-prescribe, or are they just not as open to complementary medicine? We
know this for a fact. Most of doctors, are really conscious and we really here to help, right?
Yes.
But this is the way we're taught. The Department of Health and the authority has already know this problem, right? Let me give you some statistics. Most GP, like normal GPs, let exclude me for 7, no common GP, right? When you see a patient with a normal infection, 95% are viral in nature. That is, they get over it. They just need to be reassured. They need to be given some vitamin or something, but reassure, and that's it. That should be enough. The body should pick up, no problem. Antibiotics should only be used in about 5% of cases. And guess what? Do you know how much we normally use? Every time we come from a normal cold and flu and things, it is prescribed for at least over 50 or more % of cases. Rare indeed is the doctor who said, "Oh no, you're all right, go away." And
are there cost differences between manufacturing the Myers cocktail compared to, say, prescription drugs?
Now, the Myers cocktail that you alluded to, what we do there, which is a mixture of vitamin C and vitamin B complex and magnesium sulfate, that's what it is. Those 3 main components in the Myers cocktail. That is just vitamin only, right? The cost shouldn't be much, but you're right, there is a cost in producing this, especially when A, it's not subsidized by the government at all, and B, there is a cost in producing these intravenous versus just tablet.
I'm here now with a lady named Christina. Her husband Andrew has been diagnosed with terminal cancer, and we're going to find out a little bit about Christina's experience with Dr. Nguyen and how the vitamin infusions are helping along with dealing with cancer. Thank you so much for joining us.
That's all right.
Now, I wanted to hear your story. Tell us about your husband who is undergoing the vitamin infusions and how that's helping his chemotherapy.
Okay, when we went to, when Andrew was diagnosed with cancer, the doctor that treated him at first gave us 5 minutes. He said, you are unoperable terminal cancer. There is nothing we can do for you. And Andrew went through hell and back.
Yes.
And then I remember I have this fantastic doctor. And I said, Andrew, would you like to go to this doctor? This doctor
Try
is
something
so
else.
different.
Yes.
So different. He does not just believe in pharmaceutical, he believes in everything else. And doctor said, look, I'm not claiming I will cure you from the cancer, but I definitely can help you with the chemotherapy effect.
We've just spoken to Christina outside about her husband Andrew, who is undergoing vitamin infusions to assist with cancer. Now we're about to meet Andrew, who can actually tell us himself about how he's feeling and his experiences on the vitamin infusions. How are you today, Andrew?
Good.
I understand that you are dealing with cancer.
I finished my 6 treatments of chemo a month ago,
Yep.
and I'm still taking an infusion of vitamins. They're helping me with the everyday life. They're building my immune system, and also they're helping me fight the cancer.
So what made you start the vitamin infusions? What was your first experience of the chemotherapy? I understand that the first week or so was not a good time for you.
No. Chemo is absolutely wearing off your system. You're down, you can't have a food.
Yeah.
It was terrible. But when I started getting infusion, that was completely different. Every time I had the infusion, next day I felt almost normal. I could
Wow.
have a normal meal, of course in small portion because my stomach was very infected with the cancer, so it couldn't extend. So I had a small portion and I was going okay.
And I guess that's a good thing about being on the infusion via a drip. It can go straight into the bloodstream without having to be processed by the stomach and the digestive system.
That's right. And I felt always that when I had the chemo, every time I had the drip, I felt better next day. I felt stronger. That was my thing. After the chemo, you don't even know how it is. First week in the chemo was terrible.
It sounds controversial, but again, not that long ago, only a year or two ago, with at the height of swine flu, there is another great case of the New Zealand farmer who nearly died. They were ready to pull him off life support,
Right.
but at the insistence of the family, and they even had to call a human rights lawyer in to force the hospital to give him intravenous vitamin C.
Just
And
vitamin C.
Just vitamin C, high dose vitamin C,
Right.
and he actually made a complete recovery. They were ready to pull him
incredible.
off the life support and let him die. And yet they were objecting to give him vitamin C because, oh no, we're not in the business of promising false hope or there's no evidence. Well, that's not quite true. There is a lot of
There
evidence.
is.
There is evidence out there.
So you
And
would
it's-
still prescribe an antibiotic
If
needed?
If
it was
that is most
necessary.
important, as necessary. Oh,
Yeah.
I have no hesitation. We
Sure.
should not forget, I'm a doctor first and foremost.
Yes.
The naturopath might be forgiven for missing a cancer or missing a pneumonia or something, although he shouldn't be. But as a doctor, I won't be. I'd be crucified if I so much as missing something fundamental like that, right?
I'm here today with Dr. Nguyen and one of his patients, Irene, to tell us a little bit about why she's here and how Dr. Nguyen has helped her back pain. How are you today, Irene?
I'm okay, thank you.
I believe that you're feeling a little bit better than you did 3 weeks ago.
Much better.
So tell us what happened to you.
I'm suffering from a ruptured disc, which is extremely painful.
So did you go to a doctor or a chiropractor?
Yep, went to a medical centre, saw a chiropractor and later on an orthopaedic surgeon.
And what did they say to you?
I had basically 2 options, one of which at minimum was cortisone injection, followed by possible surgery. All the doom and gloom with the other professionals. Dr. Nguyen just popped into my brain straight away, made an emergency appointment to come and see him.
Yeah.
And then it was all uphill. It was 3 weeks yesterday, and I'm walking, I'm up straight.
And this is just purely from vitamin infusions at
Yes,
Dr. Nguyen's?
That's right.
No other painkillers?
I haven't had to have any painkillers at all.
So Dr. Nguyen, when you got the call and that distress call that you said the receptionist had put through with regards to Irene's case, did you know what had happened to her and how she felt?
Yeah, the moment I heard what happened, I said, oh, because, well, I had the same thing happened in 1988. So I've suffered the same thing for a long time. So I knew right away what she's going through. Often when it's bad like that, might require emergency treatment to relieve the nerve if it is under threat. However, I feel that if we can do something, should not necessarily proceed to that, because emergency should really be emergency only when the nerve is threatened. Otherwise, no, we can do something because it will take a while.
Alternative treatment?
Well, the thing is, when it's
vitamin
ruptured,
cocktail,
yeah,
right?
we do what they call the mice infusion, which consists of which is considered one B complex, B1, B2, B3, B5, B6, B12, and magnesium, sulfate, and high dose vitamin C.
What do they do to help her situation?
Together, there's many things that it help. The vitamin C help a lot with the inflammation, which you need to stop that chemical irritation immediately. The B also help with feeling better and the pain as well, so increase her pain threshold. And the magnesium is great to stop that spasm and irritation of the nerve immediately, so help a lot with the pain as well.
She's got movement.
That's right, as long as she's getting better like this, then hey, hopefully that's it, that's enough. And hey, even if it takes 3 months, if she return back to normal, no pain, then and then no need for painkiller, that's tremendous already.
It's a great story. Thank you so much for sharing that with us today, Irene.
Pleasure, thank you.
Alice, tell us what a phlebotomist is.
Okay, a phlebotomist is someone who can collect blood and administer under the supervision of a doctor.
I remember not that long ago there was I think 3 years ago, one in the Sunday Telegraph or something that says, oh, is vitamin B the new antidepressants? Because they noticed that, people who are being treated or given adequate level of B12 and folate improve and no longer get depressed or not easily fall prey to depression. If you want to be healthy, go back and look. Something so simple and fundamental that people know about it, but hear about it, but don't want to do anything about it. Move your butt, exercise. You may still need a little bit of a supplement to feel normal. Vitamin C, for example, is absolutely harmless. If you take too much, the body will let you know by rumbling, gas, and throw it out as we do diarrhea, right? So, give your body what it needs, it will respond for you. It's simple as that.
Well, thank you so much for sharing that information with us, Dr. Nguyen.
You're welcome.
We hope to catch up with you again very soon. As we've seen, there are many success stories of people going through complementary medicine and getting great results. So next time you go to the doctor, perhaps inquire or give an alternative treatment a go. I'm Vanessa Bartlett. Thank you for watching.